Miss Matthews. I'm Bailey. I'm going to be your nurse today, and I'm going to go ahead and check you out, see what's going on with you, just do a head-to-toe assessment. Can you tell me your name and date of birth? Right, I'm going to check your wristband. Right, and then I'm going to fill out my QSIN. So we checked your wristband to make sure everything was right. Staff names are correct on the whiteboard. You don't have any oxygen, no feeding tubes, no abdominal tubes, no chest tubes. You don't have a trach, Foley catheter. You don't have an IV yet, no saline lock. Side rails, you've got 2 side rails up, bed's in low position, got call light, no obstacles in the way. Patient assistive devices, your water pitcher and cup. You don't need a urinal, toilet is by the bedside and is empty, and trash bag is attached to your bed stand. Alright, so I'm just going to do the head-to-toe assessment on you. Okay, I'm going to look at your face, look at the symmetry. Okay, everything looks good. I'm going to feel your pulses bilaterally. Okay, and then I'm also going to feel for the skin and look at what that skin looks like. Look at the respirations and check blood pressure. Okay, I'm going to listen for your lung sounds. Okay. Are you having any pain or anything or tingling in your upper extremities or arms or anything? Right, are you in any pain? Are you having any pain in your abdomen? All right, I'm just going to feel around, palpate it. Okay. Do you have any tubes or anything I should know about in the abdomen? All right, I'm just going to listen to those bowel sounds. All right, everything sounds good. Can you tell me when your last bowel movement was? And are you passing gas? Good. Also, I'm going to go back and check your skin turgor, okay, and your mucous membranes, and then also can you tell me where you're at and what day or month it is? Okay. Now, are you having any problems going to the bathroom, any burning or frequency or any discharge when you go to the bathroom? Okay, any tubes? Okay. Check out the legs. Now, are you having any pain or tingling in your legs or feet? Okay. Check for edema. I don't see any edema. Have you push on against my hands and pull away? Okay. Wiggle your toes. I'm gonna check cap refill and pedal pulses. Okay, and then I would go back up. I'm gonna go back up here and wash my hands, and I'm also gonna do the push pull with the hands. Pull away, wiggle the toes, or wiggle fingers, and cap refill. Alright, so it looks like your vital signs, you got your temperature at 98.7, your pulse at 108, respirations were 26, and blood pressure was 143/90. Skin was dry. We had poor skin turgor and dry mucous membranes. Respirations were rapid and deep, and they had Kussmaul respirations and acetone breath. Weak and tired, you're alert but weak. Stated that your parents earlier stated you were eating a lot and you were urinating a lot. Okay. Alright, so now I'm just going to go ahead and read off the case study questions. Alright, so we have Miss Matthews, 16-year-old girl that came into the emergency department. She had collapsed at school. She is alert but pale and weak. Her blood glucose was performed by the paramedics and it was read at the max or high. So additional nursing assessments should be performed at this time. I said assess their muscle weakness, decreased muscle tone, insomnia for tachycardia and tachypnea, dizziness, headache, numbness and tingling, and visual impairment. history questions that I would want to ask the patient or the parents is, what kind of foods does she eat? How much does she eat a day? Does she take any medications? Does anyone in the family have diabetes? Have they lost weight lately? Have they had an increase in their appetite? Do they have any other medical conditions? How long have the symptoms been there? And have they had an increased thirst or urination? So the diagnostic test that I expect to be run for Miss Matthews is a blood sugar, FBS, postprandial blood sugar, hemoglobin, A1C, urinalysis, cholesterol and triglyceride test, and a BMP. So then they did a glucose test that revealed that it was her blood glucose was at 523 and her urine was positive for ketones. Provider explained that she likely had diabetes. Her parents were shocked that she always had been a healthy and athletic child, and the parent asked the nurse, how can she be diabetic when she's so skinny and exercises all the time? The appropriate response to this by a nurse would be, with type 1 diabetics, it's usually found in people who are thin, and you don't have to be overweight or have poor eating habits or live a sedentary lifestyle in order to have diabetes. Type 1 diabetes can run in the family, or it can be environmental factors that might trigger it, such as a virus. Treatments that I expect to be ordered for Miss Matthews is to have regular insulin through IV with 0.9% normal saline IV to replenish her fluids, and give potassium through IV. So Miss Matthews is treated for DKA over the next 2 days. She's feeling better. Diabetic nurse and educator came to teach Miss Matthews to help administer a sub-Q insulin using insulin pen. Miss Matthews said, I can't stand needles. Isn't there a pill I can take instead? The most appropriate response by the nurse is that with type 1 diabetes, you can't take pills because the body doesn't produce enough insulin, or doesn't produce insulin at all. Other options that Miss Matthews would have for insulin administration are syringes, insulin pens, insulin pumps, and the types of insulins that she might be given is metformin or sulfonylureas. Some other education topics that should be included with discharge teaching for Miss Matthews other than insulin education is signs and symptoms of hypo or hyperglycemia, an exercise plan, diet plan, foods that she can or cannot eat, and how to manage sick days if she gets sick. Okay, so that's all the case study questions. Alright, so now I'm doing my report off to my nurse. I would say that Miss Matthews came in. She's a 16-year-old female who had collapsed at school. She's alert but pale and weak. Her blood glucose was performed by paramedics, and the meter read max or high. With a further questioning, parents said that she was very weak, have been weak lately, or weak a lot lately. She always said she was hot and exhausted. Reported that she had gained 10 pound lost weight over the last 2 months despite eating all the time, and agrees that she has been thirsty and peeing a lot. Then the nurse also noted that she had small respirations and fruity breath. Then they took another blood sugar and revealed that it was 523 and her urine was positive for ketones. Provider explains that she's likely diabetic. The parents were shocked. They didn't know how because she was healthy and athletic. So she was treated for DKA over the next 2 days. She's feeling better. They taught her how to self-administer insulin through an insulin pen. And she was able to, Miss Matthews was able to demonstrate it properly with glucose monitoring and self-administration, and her blue glucose levels were stable between 140 and 180, and they said she could go home today. And also, another thing I forgot to include at the beginning of the video is the signs and symptoms that I would look at in a person that had DKA, and that was excessive thirst, frequent urination, nausea and vomiting, abdominal pain, weakness and fatigue, short of breath, fruity scented breath, confusion, and increased blood sugars over 200 to 250 or more.